My name is Caroline Fisher. I am the Director of Psychology at the Royal Melbourne Hospital and the Director of Allied Health at the Melbourne Clinic. And I also have a private practice as a clinical neuropsychologist. So when I was at Monash, I did the Doctorate of Clinical Neuropsychology and my thesis topic was in language rehabilitation in stroke patients with aphasia. To be honest, I think my career highlight probably was finishing my doctorate. I came over from New Zealand specifically for the course. Just the confidence I gained, both as a clinician but also understanding psychological research and really the emerging skills to become a clinical leader within hospitals and the healthcare system. I think there's been some really large changes towards a real strong focus on patient-centred care. Really that's the forefront of everything we do within healthcare these days. Meeting the patient where they're at and working out what their priorities are, not what we think they should be focusing on. I just think the quality of the teaching, I really reflect on how much I always thought back to what I learned when I was here. I was fortunate enough to study under Jenny Ponsford, both as a lecturer, but also she was my clinical supervisor for my research project too. And just having someone who was so well regarded within their field both inspired me, but also showed what you could achieve within the field, as well as the university being able to source really high quality placements as well. So I got 4 very different placements all across Melbourne, and that set me up really well and helped me start to establish my clinical network with employers as well. I've almost always had Monash students in placement with me at whichever service I've been at. That we lecture into the clinical neuropsychology and clinical psychology course in the area of family violence. So we offer a 3-hour lecture seminar every year. I felt the clinical training was excellent. It really taught us how to sit in the space and be clinicians first, but also to continue to be researchers and scientist practitioners throughout our career. So not just trying to apply good clinical care, but also using our research skills to improve the quality of the care and the programs we were providing by evaluating what we're doing. I would say you'll never be bored if you choose a career in psychology. I've never sort of sat there and thought I've learnt everything there is to learn or know everything there is to know. There's just such a wide variety of different clients, a whole broad field of different areas to work in, and just being able to make a connection with people and make a difference in their lives is fantastic.